Welcome to Nationwide Children's Hospital. My name is Nick Lashutka, and I'm president of the Ohio Children's Hospital Association. I'd like to thank Nationwide Children's Hospital for allowing us to host this event here this afternoon. Welcome everybody who's decided to join us here this afternoon who, like us, are concerned about Issue 3. Please announce that the Ohio Children's Hospital Association members are all unified in their position on this important issue for Ohioans. Akron Children's Hospital, Cincinnati Children's Hospital Medical Center, Dayton Children's, Nationwide Children's Hospital, ProMedica Toledo Children's Hospital, and University Hospitals, Rainbow Babies and Children's Hospitals located in Cleveland, Ohio. We made the decision to oppose Issue 3 based upon the negative health consequences for children should marijuana be legalized in the state of Ohio. And specifically, we're especially concerned because this proposal would allow for wide open sale of marijuana and marijuana-infused products like cookies and candy and other edibles which can easily fall into the hands of innocent kids and others, possibly causing irrevocable harm. Now I'd like to introduce Dr. Sarah Denny, who's an attending pediatric physician here at Nationwide Children's Hospital and a member of the board of directors of the Ohio chapter of the American Academy of Pediatrics. Dr. Denny.
Thank you, everybody, and thanks for coming. As Nick said, my name is Sarah Denny. I am a pediatrician here in the Emergency Department at Nationwide Children's Hospital. I'm here today on behalf of the Ohio chapter of the American Academy of Pediatrics as well as Nationwide Children's Hospital. As many of you probably already know, there was a study published in June by my colleagues here at the Nationwide Children's Hospital Center for Research Policy in collaboration with the Central Ohio Poisoning Center. And what the study showed was that the rate of marijuana exposure in kids less than 5 years of age rose 140% from the years 2006 to 2013. The study was published in Clinical Pediatrics, and some of the other findings were that 83% of those exposures in that really young age group occurred within the kids' own residence. 3/4 of those exposures occurred in children less than 3. We know that states that legalized marijuana in the years from 2000 through 2013 saw a rate of 16% per year of these young pediatric exposures, with a particular jump in that first year after legalization. A high percentage of these were thought to be due to the popularity of the edible products, so the brownies, cookies, and other foods. Many of you probably have children of your own. You know that toddlers get mobility, and then the way they explore their surroundings is by putting everything in their mouth. So things that are brightly colored, things that look like brownies, cupcakes with brightly colored icing are really tempting and put those young children at significant risk. When the study looked at the kids who had exposures and were seen in the hospital, they found that most of the kids had more minor symptoms, so more sleepy, having difficulty with balance, but there were also children who experienced some more significant side effects, so kids who were in comas, decreased breathing, and seizures. So earlier this year, the American Academy of Pediatrics reaffirmed its position against the legalization of marijuana. Today I'm joined also by the Ohio Children's Hospital Association because as healthcare providers for children, we feel that this is not safe. We're afraid that making marijuana legally available to adults increases the access of children and adolescents to marijuana. There's also some concern that legalization of marijuana implies that it's a benign thing to our adolescents, and we know that that's not the case. We know that marijuana can impair memory and concentration in adolescents, as well as learning, motor control, coordination, and judgment. We also know that regular use is linked to psychological problems and issues with lung health, and also has a likelihood of leading to other drug dependence in adulthood. So as a physician here in the Emergency Department at Nationwide Children's and a board member of the Ohio AAP, I share concern with this pediatric community about the legalization of marijuana in our state because of its potential adverse effects on the health and safety of our children. Thank you.